So hello, everyone. Good morning, good afternoon, and good evening. My name is Uju Onyes, and I'm the Country Engagement and Coaching and Mentoring Lead at the Strategic Purchasing Africa Resource Center. I'd love to welcome you to the SPARC's End of Phase 1 Reflection webinar. But before we begin, I'll just walk us through a few slides on the housekeeping rules for the day. So the title for today's session is Strengthening Strategic Purchasing, Expertise in Africa, a reflection and learnings from Phase 1 and looking into Phase 2. So this webinar is going to take approximately 90 minutes, and we'll try our best to ensure that we wrap up in time. Next slide, please. So just to let you know, we do have interpretation feature available on this webinar. You can use the translation feature to switch to either English or French, any of your preferred languages. We'll request for you to please put your phones on mute when you're speaking. And then also, if you want to share questions, comments, you can use the chat feature or the Q&A button to type in your question. We strongly encourage you to use this feature because we're really excited to hear from you all today. Next slide, please. Thank you. So we ask that we're happy to have you here. We ask that you stay present with us, stay mentally alert. We're going to have some really engaging conversations today, and we're really excited about the discussions ahead. So if you want to share some of your comments and thoughts on Twitter or social media, please use the Reflecting on Our Story hashtag, and do tag us on Strategic Purchasing. We're going to share our hashtag to our Twitter on the chat. Please tag us as well so we can continue the conversation going even after the webinar. Thank you. Thanks. So SPARC was launched in 2017 through a 4-year BMGF grant to set up a resource center dedicated to strengthening strategic purchasing in sub-Saharan Africa. On our first phase, we focused on setting up the SPARC hub within the African region, setting up a suitable institutional host for us within the African continent, setting up technical partnerships for evidence generation, incubating a community of experts, and deploying these experts for our technical support to countries within Africa using our signature coaching approach. As we've come to the end of Phase 1, we thought it'd be really useful for us to take a pause to discuss and to reflect on our journey so far. Our exciting line of speakers today are set up to do that, exactly just that. Our speakers are made up of experts from within our AMREF host institution, from our community of experts, technical partners, and also policymakers who have all engaged with SPARC at some point during our Phase 1. So we will discuss with them their experience working with SPARC or engaging with SPARC, and we'll focus on the learnings and reflections from this. So SPARC's positioning within AMREF will also be discussed, as well as our vision for Phase 2. So to start us off, I'm pleased to introduce our first speaker today to give our welcome remarks, Dr. Kithinji Gitai. Dr. Kithinji is the Global CEO for AMREF and a passionate advocate for universal health coverage. It's a pleasure to have you here with us, Dr. Thank you for joining us.
Thank you. Thank you so much. And thanks for having me, Dr. Onyes. And I'm looking forward to what comes out of this conversation. I must say that I'm actually double dating. I'm being unfaithful because I'm in another meeting right now. And it's interesting that the conversation we are having on this other meeting is on health workforce development for Africa. So we are hosting a consultation across experts in the continent to ask the question of how does a fit for purpose health workforce look like for the continent? Of course, during COVID-19, we've learned harsh lessons. Those lessons include the fact that our health system was suboptimal. We've seen extreme fatigue of health workers. We've seen that we do not have capacity of lab technologists. We've seen that community health workers were not properly empowered. And even now, we're struggling to maintain adequate health services. And we are waiting to see if Africa was to get another wave, what would we do? And this conversation we're having on the side is about health workforce. But you know what? Health workforce is all about efficiency. It's all about which is the fit for purpose health workforce that gives you best value for money for what services, and what services to who, and where and how are they provided. So kind of the meeting I'm double dating you with is actually connected to the strategic purchasing conversation. If you look at the AMREF Health Africa strategy, the strategy is based on three things. One is how do we have a fit for purpose human resources for health, starting at the front lines, including, most importantly, at primary healthcare. And how do you enable delivery of innovative services at primary healthcare and across board for all communities leaving no one behind? And how do you, most importantly, finance and enable adequate investments to enable these services that we talked about to be delivered? And we hope that by approaching it that way, we then enable the continent of Africa to achieve lasting health change through universal health coverage. So when the Strategic Purchasing Africa Resource Center came to us, we found ourselves ready with a strategy, but we needed to do more work on developing our own capacity as an organization to be able to actually learn from SPARC and for SPARC to learn from us. But there was a critical conversation that AMREF has the networks that are necessary for SPARC to enable change in the countries. And that became our biggest asset to the partnership. So when we started SPARC, we started to learn from a partner like Resource for Development. And I must thank R4D for working with us on this journey. And of course, also thank the key donor, the Bill and Melinda Gates Foundation, through the Global Delivery Team, for supporting this partnership for development. Let me remind us that African continent has the lowest per capita allocation to health. When you do a quick calculation, on average, we are talking maybe of general public expenditure, you're talking $35. And in my own calculation, even if you were to achieve a Abuja declaration and achieve a higher tax efficiency in the continent, which is difficult, you'll be lucky to mobilize $60 per capita, which means that efficiency in resource allocation, where should the resources go, for what, and to who, and how, and accountability frameworks, pay for performance, and improving overall efficiency is really the most critical conversation we can have for Africa to achieve universal health coverage. So as per an article I did on primary healthcare in the Goalkeepers report, I said I spend a lot of my time thinking about a small number for big goals. And that small number is the health financing fiscal space that's available. So we have learned a lot so far from engagement with SPARC. We have not been perfect. Our systems sometimes have been challenging. Our learning agenda has not been frictionless, but we are glad that we can learn from that phase and also reflect on the next phase that's coming up, which is phase 2, which we are very, very, very glad to lead and work continuously and continue to work with our partners, including Resource for Development and the donor and all the partners across the continent, to ensure that we can now accelerate our learning, accelerate our impact, and ensure that Africa prepares a pandemic-ready health system that's resilient enough to overcome this pandemic and the next one through resilient, efficient health systems. This is what I would like to say, and I look forward to the outcome of this consultation. Thank you very much, and back to you, Dr. Thank you.
Thank you so much, Dr. Kithinji. That was amazing. And we at SPARC also really look forward to continuing this amazing and mutually beneficial relationship with AMREF as our host institution. And we really look forward to phase 2 and like leveraging the impact that we will have with the power of AMREF behind us and your amazing network as well. So thank you so much, Dr. for that. So now we're going to take a look at some of the accomplishments we've had in phase 1. So over to you, David.
Decisions we make determine who lives and who dies, who is in pain and who finds relief. Decisions we make determine which will hold true, life or death, pain or relief.
We have survived this harsh world because of strategy. So strategy is what we need. And because nations and patients care about their sense, it makes more sense to quench the thirst for sustainable solutions. Around the world, 14% of the health budget is lost due to inefficiency. Here in Africa, we are no exception. And if we do not innovate on how we spend, we will reverse every advance we've made in this last century. Think about that.
In 2017, we started developing momentum for strategic purchasing across sub-Saharan Africa and building the continent's growing critical mass of skills and experience. We set out to match countries implementing strategic purchasing approaches with regional experts familiar with local contexts. So, what have we accomplished? In Kenya, the National Hospital Insurance Fund received coaching from SPARC to position the NHIF as a key purchaser in Kenya. A SPARC mentor supported the NHIF Reform Panel to prioritize actions to strengthen the NHIF's purchasing functions as part of the country's universal health coverage agenda.
We've got technical assistance for many years. It has worked in many respects, but then there's still some aspects in which it hasn't solved our problems. So how do we go about getting a way to completely and holistically solve our health financing problems, or find a new approach to doing that? And the new approach was to recognize that there is a lot of expertise on the continent. And what was important was that in addition to providing technical assistance to the various countries in Africa, there was also need to maximize these expertise that we saw was available.
During the time in my task force, I was the chair of the business processing re-engineering committee. And it is really that committee that is coming up with ways of how to re-engineer NHIF, because that's the heartbeat of what will make NHIF work. And my first interesting experience with him was his subtleness, his approach to things. He introduced himself as a mentor, and every time we'd have meetings, he would come in very reliably, never late, sit there very quietly observing and taking note of what was going on. He'd only speak when he'd probably realized that we are veering into areas or into a certain way that we have not taken cognizance of something. And he'd never point out and say, you're going the wrong direction or you're doing this wrongly. His approach would always be in a very subtle way, have you considered this? Have you looked at this? And then pull back completely and watch us debate and deliberate on that. And I thought that was very interesting, because whenever he'd do that, our minds would open and we'd realize, actually, we never thought about that. And without him saying, you've not thought about that. And then throw it back to us to think. And I thought that approach was very interesting, very interesting. Yeah.
The Burkina Faso Ministry of Health requested SPARC's support to work on its purchasing policies that led to the redirection of funds to the government's priority program, Gratuité. This program currently provides free healthcare to women and children under 5. In Rwanda, we collaborated with various stakeholders on an action plan to boost strategic purchasing and assure the financial viability of the community-based health insurance plan. We have strengthened our strategic health purchasing bond with Kenya, Burkina Faso, and Rwanda, and we continue to increase our country engagement scope within Africa through our coaching approach. So, what have we achieved in the past 3 years? Let us listen to the journey so far and the SPARC promise for the future.
Yeah.
Decisions we make here will determine who lives and who dies, who
is in pain and who finds relief. Decisions we make here will determine which will hold true. Life or death, pain or relief. Meaning we're not here for a good time.
No.
We're here for a long while.
Yes.
And we shall fan the flames until the picture frame speaks of generations saved and destiny stained.
We are the ones that'll save the day and the nights for all to say. A free, a free, a free, a free, a free Africa, a free, a free, a free, a free, a free Africa, a free, a free, a free, a free, a free Africa. Started amidst the odds, answered in earnest the call. So far, so good, so far to go. Here we come, so far we'll go. Hey! Pump it up. No one will listen till you're loud enough. There's no intermission for the ones who will reach for glory, immortal through feat and story. Pump it up.
Greetings. My name is Elsafan Jora.
And I am Timothy Arinaitwe.
Welcome to this journey that we're going to take you on. One, in a time where individuality has plagued us, SPARC lit a flame and found a home in Amref. Two,
in a world full of silos, we have connected expertise within the continent and matched them with country needs.
yes, check this. We have 11 partners in 10 countries.
We have Anglophone and Francophone partners.
Hey, bonjour.
Bonjour, monsieur.
Ah, ça va?
Ça va bien. Et toi, tu vas bien?
Très bien.
Oui, oui.
Ah, allez.
We have Anglophone and Francophone partners, including academic institutions, think tanks, and policy and research institutions all around the continent.
With over 200 members of experts.
And reforms in Rwanda, Burkina Faso, and Kenya, further solidifying our value add.
Three, in systems that have struggled to fully operate, our scoping visits focused on supporting countries to articulate their demands while matching them with the right resource. Meaning, we served as a resource and knowledge hub for practical tools and best practices. Four,
only 3 years in the making, and we have raised awareness through several platforms, including conferences and webinars. I mean, even COVID couldn't stop the wave.
we started amidst the odds, answered in earnest the call.
So far, so good, so far to go.
Here we come, so far we'll go. Healing like conquering is quenched only by more. Healing, like conquering, is quenched only by more. The difference is that one builds a steam while the other subdues it. But without support and resilience, the counter will overwhelm it, because every force has an equal and opposite consequence.
But now that we're in the purpose of health, I pray that we remain resilient.
Yeah.
Not with the thought of defeat, but in full view of our
Victory.
Let the dream be the vision so that history will muse over this story.
Which story is that?
When a disease, accident, or occurrence wasn't a death sentence or a bankruptcy assured.
When access to quality health services was across the board, across the continent, in every town, village, homestead, or crevice, whether rich, broke, middle class, or whomever. We started amidst the odds, answered in earnest the call. So far, so good, so far to go. Here we come, so far we'll go. They say history has many faces, depending on your relationship with the writer. Well, we are the authors. And now that we've written phase 1, may we write even more. Enough to bless all faces with hope for the winters. Enough to ensure that there are no more excuses to universal healthcare and that we can all be winners.
In full view of this, I am pumped because the future is not just bright, but within our grasp. And we are in a position to bring it even closer.
Speaking of closer, my late sister, a doctor, said that the fight for the right to health is not for posers.
Actions speak louder than words. And may we pump that volume to break even walls.
Loud enough to build bridges so that the gap between the rich and the poor shortens.
They are clear enough so that doctors around the continent don't have to suffer mental health issues to the point of depression because they're seeing systems succumbing to symptoms of inefficiency, continuously letting patients get sicker and sicker, and yet we can do something about it.
Convicted enough so that you and I can say,
We, Africans for Africa,
started something and have taken it as far as we can, placed enough infrastructure and instilled enough willpower to push it to the next phase.
and the next, and the next. Oh yes, the miracle has just begun and we have barely scratched the surface of what needs to be done or what we are even capable of. So may we fasten the saddle and buckle up. There's no room for buts, maybes, if only we had, or next time. There's no room for buts, maybes, if only we had, or next time. The moment that we have been waiting for is now. Look, we have been making good progress in the fight against the fragmentation of the health sector by enabling a space where all the elements and the stakeholders can work together.
We have focused on neutrality in supporting countries, giving more power to a unified voice.
You see, the impact of phase one was always about preparing the ground and planting the seeds. We have seen good progress in the coaching approach because we are not just instructing you to do, we are helping to do, learning by doing.
Like a bamboo farmer, it may take years before we see fruit.
That's true.
But as the Kenyans say,
Kwa ground, vitu ni different.
meaning on the ground, the story is different.
The difference here is being made by consistent steps. You see, decisions we make here will determine life or death, pain or relief, no pressure. Decisions we make here will determine which will hold true. And we said that in 2019, and we're still here, meaning we're not here for a good time. We're here for a long while. And we, you and I, Africans for Africa, shall fan the flames until the picture frame speaks of generations saved and destiny stained. Listen, we are the ones that will save the day and the nights for all to say. No room for buts, if only or maybes. No room for buts, if only or maybes. We are the ones that will save the day and the nights for all to say. No room for buts, if only or maybes. No room for buts, if only or maybes. We are the ones that will save the day and the nights for all to say. No room for buts, if only or maybes. The moment that we have been waiting for is now.
Started amidst the odds, answered in earnest to the call. So far, so good, so far to go. Here we come, so far we'll go. So far we'll go. We started amidst the odds, answered in earnest to the call. So far, so good, so far to go. Here we come, so far we'll go.
Hey, hey, hey.
Pump it up. No one will listen till you're loud enough. There's no intermission for the ones who will reach for glory. Immortal through feet and story. Pump it up.
Yeah.
Pump it up. No one will listen till you're loud enough. There's no intermission for the ones who will reach for glory. Immortal through feet and story. Pump it up. Pump it up. No one will listen till you're loud enough. There's no intermission for the ones who will reach for glory. Immortal through feet and story. Pump it up.
Hey, 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 hey.
Pump it up.
No one would listen till you're loud enough. No intermission for
The ones who will reach for glory. Immortal through feet and story. Pump it up.
hey. Pump, pump, pump it up.
Thank you so much, Al-Safar and the team for that amazing presentation. That was really fantastic and perfectly brings us into our next session, which is the panel discussions, where we'll talk about some reflections from some critical stakeholders that have been with us along SPARC's journey. That was amazing. I don't know about you all, but I feel pumped right now. So next, I'm going to introduce Nathaniel Otto. Nat is a health systems and public policy consultant and a senior fellow at the Results for Development Institute. As you saw earlier from our video in Kenya, Nat was the founding executive director for SPARC and was once served as the CEO for Ghana's National Health Insurance Authority. So I'm really excited to hand over to Nat so he takes us into the panel discussion sessions. Over to you, Nat.
Thank you very much, Uju, and thanks, Dr. Githinji, for your opening remarks, as well as the excellent delivery by the duo. It is no surprise that in Africa, we tell stories, and stories are what convey our learnings and experiences. So this was not an accident, it was actually well intended. And to supplement this, we are actually going to elicit experiences from people who have been connected with SPARC right from its onset until now, people who have had different experiences with SPARC. As you all know, and might have heard previously espoused, SPARC came up, with three key legs that it stands on, and those key legs are country engagement, in addition to knowledge management, and also getting a team, a cadre of experts who are going to act as coaches and mentors. So this is how this has been designed. But to make justice and to this topic, I'm going to invite three distinguished panelists to talk to me about what the experiences have been. First, we have Elizabeth Ikarapa Kiracho. Elizabeth is a senior lecturer at Makerere University in Uganda. She holds a PhD in health systems research and has over 15 years of experience in health systems research. Her key research work focuses on maternal health, health systems, and economic evaluation, amongst others. We also have Jean-Paul Dosu. Jean-Paul Dosu is a medical doctor and a public health scientist from Benin, experienced in applying health research and evaluation approaches, as well as systems thinking principles to complex health issues. He leads an institution in Benin called CERUT for short, and currently is supporting Burkina Faso in its ambition to strengthen its strategic purchasing capacities. Next, we have Gilda Odera. Gilda is from Kenya. She was the co-chairperson of the panel of distinguished persons that advised the Kenyan government through its Ministry of Health on key reforms for restructuring and repositioning Kenya's National Health Insurance Fund into a strategic purchase of health services. Gilda served on the NHIF board and is the current and first female deputy president of Kenya Federation of Employers, East Africa's largest umbrella proprietor, or umbrella society or association of proprietors. So welcome to you all distinguished panelists. I'm happy to have you all. Now, to broaden this introduction a little bit more, what I told you about was the connect, the match, and the share. Connect in terms of building a coaching and mentoring cadre of experts to serve as a go-to resource for strategic purchasing on the African continent. And matching is actually about country engagement. How do we match country needs with expertise that is available? And using the regional experts who understand local context. And finally, knowledge management or joint learning serves as a resource and knowledge hub for practical tools and best experiences in strategic purchasing. So I believe by the end of this, they would have shared their experiences working with SPARC in phase 1 and what their expectations are in regards to phase 2. Thank you all very much for agreeing to be part of this panel. Elizabeth, my first question goes to you. During phase 1 of SPARC, SPARC worked with 10 technical partners, your institution included, to co-develop a framework for mapping, assessing, and describing strategic purchasing progress in 9 African countries. What lessons did you learn from this exercise, and how have these lessons helped in the provision of technical advice to your country from your point of view?
Good afternoon, everyone. Thank you, Nat, for that question. Indeed, one of the key things that the framework taught us is really what strategic health purchasing is. Before, many of us thought strategic health purchasing was equivalent to results-based financing or performance-based financing, and that's what will come up in our minds whenever we thought about it. But when we engaged with the framework, we were able to appreciate the different functions that are important in strategic health purchasing. Thinking about financial management, thinking about benefit specification, contracting, provider payment, and monitoring. We're able to appreciate better what each of these functions are and how they come in terms of ensuring that you're able to provide the services that you prioritize. Aspects need to work together. For example, many countries have now made progress in terms of trying to identify the benefits that they want to provide to their countries. But we realize that having a benefit package alone is not enough. You need to deliberately ensure that you identify providers who are going to be able to, in some of our countries, taking first the example of Kenya and their Linda Mama program, they were able to identify and to selectively contract both public and private facilities to provide those services. We've also seen this come to play in Uganda with results-based financing that is increasingly being done in the country. A package has been identified, but providers had to be accredited to ensure that they have the capacity to provide the services. So we realized that in these examples I've given, for example, you have to identify the benefits, but also selectively choose the providers who can provide those services. And of course, issues to do with how you pay them, how you contract them, and what guidelines you develop and use to monitor them, all play a critical role in terms of ensuring that you're actually purchasing those services strategically and delivering these benefits. So we got a much deeper appreciation of that, and we are therefore in a better position when we are giving advice within our country, technical advice, technical support, and when we are participating in discussions, we have a broader picture of what we need to be able to do for us to be able to make progress in terms of strategic purchasing. So that is something that was really brought forward by the work that SPARC was doing, and specifically using this strategic purchasing framework.
Wonderful, Elizabeth. And I really liked what I heard from you, because you actually, alluded to the fact that a lot of the discussion was about schemes, whether you're using, performance-based payments, or whether you're using, national health insurance schemes. Those were the discussions really, but what you've done is actually to distill the key issues into the functions of strategic purchasing. That's really exciting for me. I'll take you up on that further, but I won't go away still, because I still have a lot to elicit from you. You started with SPARC right from its inception, and I remember meeting you at one of the first meetings of experts in Kenya. From your interaction with SPARC and its technical partners, from that to the coaching and mentoring community that you've been engaged with, how would you assess the level of expertise available on the continent to support strategic purchasing reforms, and how can this expertise be effectively leveraged if it exists at all?
If it exists at all. Okay, so SPARC has indeed shown that within the continent. We do have expertise, and it's difficult to measure or to give you a figure about the level of expertise. But through the engagements we've been having, for example, through the force and other networks, we've been able to see that in practically every country, you're going to find health economists, you're going to find health financing specialists, you're going to find people with expertise in this area. And we need to utilize the in-country expertise that we have more. So talking about how we can leverage that, there are times when we depend on expertise that comes external to the country, but we need to look more internally at the expertise that we have and work with that expertise. So what SPARC has been doing in terms of, first of all, enhancing the capacity of the in-country personnel that we have, or experts that we have, and then encouraging ministries of health and organizations to work with this local capacity is one of the things that I think will give more opportunity for the in-country experts to support their countries. It will also, of course, help them improve their capacity, but it also provides sustainable support. Because these experts are often in country, they are embedded within the systems, they understand the systems, and they're able to continue providing that support. So availing this opportunity and continuing to reach out to these experts in country, I think is one of the things that we need to do on a larger scale. Providing forums, maybe let me end with the issue of also providing forums for cross-learning and sharing lessons has also been particularly useful, because it provides an opportunity for you to see that they have the solutions that they have tried. You're able to clearly see what is working. You're able to also appreciate what is not working, so that you don't fall into the trap of introducing in another country. So providing those forums as well. Yeah.
Thanks so much, Elizabeth. That's really eye-opening. Jean-Paul, I mean, this is a segue to what I'm going to ask you, actually, because you were also one of the members of the technical consortium that worked on generating evidence on strategic purchasing reforms in Africa. Now, looking at how you worked with the various technical partners to do this, and what Elizabeth has said in terms of the availability of expertise, really the often said or the often repeated fact that Africa lacks expertise is not really the issue here, because there is some expertise. So what else do we have to add to that expertise to seize traction? So the question I want to ask you is, having been involved in the mapping exercise, did you find evidence that was valuable for strategic purchasing reforms? And how has this evidence been brought to strategic purchasing discussions in Benin, your native country? And what challenges, if any, have you faced in doing so?
Thank you very much, Nat. When you are talking about this issue of strategic purchasing, I remember the first day I met you, and I see in your face, and that shine also in all the group of people that I have seen in the team working on this with you. I see passion. And this is probably one of the key words that for me is very important now in what I see as a strength in SPARC. Passion. Passion is there. And as one said, passion is contagious. And personally, I have been very contaminated by the passion on this issue around strategic purchasing. And now what I say, I see, I do about strategic purchasing is really a positive contagion that comes from you, from Cheryl Cachin, and from people working with you like Oludare and all of those groups, Enoch. And I use this opportunity to greet all of you for all your effort and for your inspiration and your contagious passion for strategic purchasing and for better universal health systems in Africa. Then for me, something that was really important is also creativity. You know, this issue about strategic purchasing is relatively new, even though there were already some activities and some effort that was not clearly labeled like that. Some effort are on the way in countries, and it requires a lot of creativity to adapt what is in books and make it make sense for people on the ground, make it translate them in words and in formulations that make sense for them, and that can open a conversation around this concept of strategic purchasing. So creativity was a key thing that I want to highlight. And then boldness because we are opening new wings, new doors in spaces where it was not always easy for people to look themselves in the mirror sometimes and look at what they can improve. Because as you know, what we used to do is always the better place sometimes where we want to stay, is a comfort zone. So it requires boldness to push systems in a direction that move people away from their comfort zone, and that requires a lot of boldness. And in Benin particularly, engaging in these exercises creates like 3 types of changes I have seen. So it was not as such the evidence that we gathered at the end of the process that was the main, what I can call active ingredient of this mapping exercise, but it was also the process in itself, the way it make it possible to engage people, to communicate, to open conversations. That was also a very transformative approach. And I have evidence today that this process have led to capacity development in countries for health financing in general, but also for strategic purchasing particularly. For instance, in this process, we inspired some vocations. We inspired people to make career about health financing, about strategic purchasing, to learn more, to participate in courses, to build their capacities. And now they are working in research centers and they are involved in larger project working on strategic purchasing. And that is a kind of also changes that this brings. We have seen also in countries networking and the removal of silos. And we have seen dynamic between the Ministry of Planification, the Ministry of Finance, and then researchers working on issues that require this kind of multi-sectoral engagement. And this was inspired by the process that SPARC bring into country through this mapping exercise. And also we have seen regional mutual learning. And we have seen, for instance, a consolidation of a vision for strategic purchasing in a country like Burkina Faso, starting from the workshop that followed this mapping exercise in Cotonou. So to make it short, the process in itself was a very powerful formative tool, and various streams of changes have started from there. And we can also talk later more about how evidences have been very useful in that journey. Thank you very much, Nat.
Thanks so much, John Paul. When I listen to you, delivering, sometimes I wonder whether I ever learned English at all in school. But, but having said that, you said something that was really very important, and it's the regional networks. And I'm just going to follow up on that because I have learned that, you have actually been selected by Burkina Faso to be a mentor in some of the change processes that they are following. I hear that Burkina Faso has, worked with you to facilitate dialogues in order to select what are the priorities in terms of strategic purchasing and spending of their scarce health resources. Can you bring us up to date on how this happened, how you've gone about it, and what are the lessons we can learn from it?
It has been a very fantastic experience, and I felt very lucky and to be engaged in this journey with Burkina Faso. So it is a journey we have started. We have passed some milestones, and but we know that we still have a lot of. But what was very fantastic First is the openness of actors present on the ground. The fact that they were really open to this conversation around strategic purchasing, because they were really willing to make a bold move about improving the practices, the purchasing practices in country. So came in really with inspired by the three key words of the way SPARC promote support to countries: neutrality, system focus, and facilitative approach. And I can even add the sensitivity to the context. Being neutral means really that we care with no specific ideological positions about what is right or what is wrong. We came really open to be guided just by evidence, just by really what the common objectives of country, and just by asking critical questions that could help to see beyond the what was like obvious, and really go deep to look at, to interrogate, how do we think that what we are doing can help us lead to a desired change. And we make it really, being system focused mean for us that we wanted really to embrace as large as possible and see what even could be the unintended consequences of what we used to do or what we were expecting a team to do. And this open the conversation and make it easy for many groups of people to see the role they can play. And we came also with the idea that there was no like one way to solve any problem around strategic purchasing, that we have really to build in countries, to build on in countries' willingness, capacities, and energy. And this energy management is also the other dimension that I want to highlight about using a facilitative approach. Because in-country staffs, most of the time, they have to deal with so many conflicting agendas sometimes. And managing their energy to achieve some changes is very important. So being sensitive to their energy and the way we use it intelligently was also a key point. And using facilitative approach means also in Burkina Faso concretely communicate in a very simple and very understandable way, transforming what can look very complex in theory into simple words, using metaphors that can make them compare what we are talking about with concrete realities and concrete situations and concrete stories that exist in the context and that they use to live with, so that they can realize the concreteness of a concept like strategic purchasing, and that how they can make change about it in their context. I think so far this has been quite helpful.
Wonderful, John Paul. I will come back to you presently, but I also want to this time go in a different direction, because I've heard from you, a coach, I've heard from Elizabeth, a technical partner, but also part of the force community. We are going to hear from Gilda. Gilda was on the video earlier in the opening of this session, and I want to delve a bit more, into Gilda's experiences with SPARC. Gilda, you remember that in 2019, SPARC provided coaching and mentoring support and a secretariat to support the health financing reform exit panel established by the Cabinet Secretary of Health in Kenya, of which you were co-chairperson. What stood out most for you in SPARC's approach in providing this support? And what can SPARC do better in tailoring this approach to a country's policy reform needs?
Thank you, Nat. Nice to see you across that side. Other than what the participants have heard in the short clip, I will not repeat much of that. But what I wanted to talk on regarding the approach that has not been mentioned so far, because the rest have, is your strategy. It wasn't very obvious that there was a strategy until at the end of it, and even much, much later that I have come to realize that Nat, you knew the end from the beginning, in the sense that since you were the one with us as a coach, for you to be able to listen in and know when to step in, you knew exactly who the stakeholders were, what their interests were, what you need to possibly open their minds to think of or through, what are the obstacles that are already there that you would have to see how to overcome. I'm saying this because, as you're aware, we had very many stakeholders in this whole exercise that we undertook as the panel of experts. And there were days that we had very emotive contributions, because you have stakeholders who feel our ground is being shifted, or the suspicion. As you introduced me, I was just outgoing then from the board and of NHIF, and I had just finished my term, and I was appointed to sit in this panel. And so there's that aspect of suspicion from within, possibly the people within NHIF. What are these guys up to? And yet there you were, having to make everybody, without speaking much, make them comfortable enough to speak out their minds, and be comfortable enough to say what they think should change or should not change, and be comfortable enough to listen to the other parties. And I thought that was very, very strategic. I use the word strategic. It may have not looked like that to us then, who were sitting there then. I remember, and I must say this, when you first would see you there, and I'd wonder, so what's this guy doing? He's not talking much. But at the end of it all, it was obvious that you were there to coach and mentor, observe, and be able to know where to step in. In terms of the policy, how you think this approach, SPARC could do better in tailoring this approach? Okay, for one, I would say don't change the approach in the sense that you were observing and stepping in when you needed to, because I think that's what helped people be able to feel free enough to share. I see somebody saying it's cutting. I don't know if it's my side or their side.
Your side is fine.
Okay. And but one of the things that I would say regarding the mentoring and coaching approach when it comes to country reform and policy, I've been involved in policy as much as I sit as the first deputy national president. That's not a full-time job, but I've been involved in policy in both through LHIF and health, and in the education sector. And one of the things that is always a challenge, as I mentioned earlier, is the element of suspicion. What are these guys up to? Why are they here? What do they want to do? They're up to no good. And I think that involvement of, whichever country you are, involvement of a local expert and working alongside local experts would help possibly just make that suspicion disappear from the word go. By the middle of it, and I must say that people come to realize, no, they're not up to anything funny. But to enable people to open up from the word go, maybe that could be one thing if it's not yet been introduced. I also thought that another approach, because the mentoring approach is pretty effective, especially when you're meeting stakeholders as a group. And I'm thinking that in such an instance like the sorts of activity that we had as a panel, maybe SPARC would be able to engage. And I know we actually did separate that. We had various stakeholders. We didn't just bring everybody in one room. And I think that's one thing that needs to continue. You meet this particular stakeholders within the area itself. And then before you bring in larger groups, so that you're able to have them express themselves and be on the same page by then. So that's what I'd say about that, Nat. But in a nutshell, it was the mentoring approach is very effective, because by the time we finished, we didn't have people fighting, so to speak. I did not see the sentiments, being expressed in anger. As I said, I represent the employers when I was sitting at the NHIF board, and so I know that there's this aspect, and yet within that panel, some of the things that were being suggested were going to affect us as employers. But this approach was able to make stakeholders remove themselves from who they're representing, as much as you have to take cognizance of who you're representing and look at a bigger picture, look at a wider picture, and look at the country benefit to all this. So I thought that was good. Thanks.
Wonderful, Gilda. So what I actually have, gleaned from what you just said is that at the end, the process must be all owned by everybody involved. And that is what we were able to achieve. Interesting. But the one thing I'll bring, to your attention again is that I did realize that Kenya is not short of experts. And what needed to happen was to get people to, think along the issues at stake through a facilitative approach. So thank you very much, Gilda. But I won't let you go. I just want you in a few minutes or in a few seconds to tell us, because this panel that you were involved in submitted its report, and unlike reports that are submitted in many countries, some of the recommendations that were made have actually found themselves into legislation and policy review. In your view, is there still room for SPARC to support, to actualize some of these policy reforms?
Yeah, Nat, I would think so, because if you look at what's in the amended bill, there quite a lot of what came out of the discussions we had and the recommendations from the report. A lot of the changes there came from the report. And if you look at some of the empanelments, the contributions, in fact, we were worried that employers are going to hit the roof and say, we're not going to match the contribution. But I must report that on discussions with the relevant ministry, that the employers have said, okay, that's fine, but can we stagger it? And so you see, if you ask me, almost half of the things we discussed, quite a number are already in that bill. Now, the room that SPARC has, and I think you have a really important role to play there, is to see that this implementation is running on track and is being implemented according to the intention of the panel and of what has been amended, because people can implement, but in a different direction. Right. And I think that's where your role is, to continue working with these stakeholders and mentoring, coaching them, and just monitoring the milestones and being able to open their eyes to see we're here, and so now where are we going? So to me, it doesn't end where it's, the reports ended.
Right. So you're saying clearly, Gilda, that policy reform is a journey. It's not one activity that stops, and it's a continuum. Yeah. Thank you very much for that. When we have such conversations, the feedback I get from you guys is so amazing that I never wanted to stop, but time is limited, unfortunately. And we're going to go to phase 2 of SPARC currently. And what I want you all to do, Jean-Paul, Elizabeth, and Gilda, in no particular order, but I think I'll start with Gilda, is as phase one comes to an end and preparations are afoot for the implementation of phase two. Can you give me just one sentence, short sentence that reflects your expectation for phase two of SPARC and how SPARC will be better able to support strategic purchasing reforms in sub-Saharan Africa?
Nat, I think my last sentence said it. Continue working with the stakeholders in implementation of these recommended amendments in the bill, and those that have not yet been amended and need to be amended in the country.
So SPARC phase two, you can hear Gilda clearly. What started should not be stopped. You continue the journey with the stakeholders. Can we hear from you, Jean-Paul?
I think I have actually two key words: bridging, and the other one is learning. Keep learning about strategic purchasing and ensuring that it is the way for all the actors, stakeholders that are working in countries. If we make life of people easier, eventually they will always be with us.
Wonderful. Thanks so much, Jean-Paul. Learning and also getting, to ensure that strategic purchasing is ingrained in our systems is very important. Thank you very much, Jean-Paul. Elizabeth.
Thank you. I think the key words for me are interacting, listening, and planning. So continuing to enhance that interaction between the researchers, SPARC, national level and sub-national level stakeholders, and actually listening to what each stakeholder is doing or each stakeholder is saying, and putting that together to carefully plan for a roadmap that can help you implement the changes that you need to take in a very precise manner. So interaction, listening, and planning.
Wonderful. Thank you all very much. I think Amref and the rest of the SPARC team, you can hear this very clearly. Thank you very much, Gilda, Elizabeth, and Jean-Paul, for speaking to me and for making your experiences with SPARC known to the entire audience. Thank you very much and have a wonderful day. From now on, we move on to a question and answer session. As it is always in discussions like this, we know you have questions that you'd like to ask of the speakers, and we are happy to fill those questions to them. You can put those questions in the chat function, but also you can send them by other means that will be received by the SPARC team. Some of them might not be answered immediately. We'll curate the answers and share them with you. Now, I see a question from Obioma Obikeze. And he says, being new to the concept of coaching and mentoring, I'm yet to deploy it in any TA assignment. However, I'm inclined to ask him the feasibility of using this approach when the demand side of the TA engagement, shows preference to use traditional TA. I hope I have made my point enough clear here. Yes, the point is very clear. With SPARC, there is no divide between the traditional approach and the coaching and mentoring approach. It's only additive. So it doesn't say stop the traditional way you're working in technical assistance, but also to say that you can have coaching and mentoring as an additive. I think Gilda will tell you in our experiences with Kenya, that we also actually reached out and brought expertise in other areas, many other areas, to supplement the work that was being done. But in the end, it was the panel which actually, interrogated these pieces of technical support to see their relevance and how useful it was. So I have dealt with this myself. We'll be happy to get any other questions there are, but as I don't see questions coming through, are there any, Uju and team?
Hi, Nat. No, just that for now.
Okay. Now I will probably have.
May I say something to add to that question that was being asked?
Go ahead, Elizabeth.
Yes, so Uganda is one of those countries where we tend to kind of still use the technical, advice approach. And through our experiences with SPARC, we've learned that what we've learned through the coaching has still helped. because, you know, in my personal experience, I've found that having been more aware of these things, when you're given an assignment, we are currently working with the government to review our benefit package. So we have been more keen to listen to what the different stakeholders are saying. In the past, would kind of take an approach where you're saying, what is the evidence saying? What are the things that we need to do? And you don't pay as much attention to what is this commissioner saying? What is this health worker saying? And what is the reason why they are saying whatever they are saying? So we've listened more, appreciated their side of the story and why they are saying that, and aimed at coming up with a solution that balances the evidence and also balances the reality on the ground, so that it's actually speaking to the needs rather than bending so much just in the direction of the evidence. So even with the traditional approach, you're able to take these lessons and use it there to inform and guide what you're doing.
Thanks, Elizabeth. That's really very impressive. I read another question, and the question is from Julia Oko. She says, as a lead to strategic purchasing, revenue collection is key. Any role for SPARC, you know, in this in Kenya? Maybe you can deal with this, Jean-Paul, and then Gilda will supplement.
So thank you for this question. What we have seen in the conversation with Burkina Faso, for instance, is that there is a kind of cyclical relationship between strategic use of money to really create value for populations using services and building trust, reinforcing trust between populations and service, and an influence on mobilization of resources, more resources for health, eventually first passing through mobilization of more finances for health, but beyond that, mobilization for more political support for allocated to health. Through strategy, we have a really and powerful tool to promote performance at the point of service delivery, and mainly creating added value for people coming to any services where they can see a real change in performance. And when this happens, as the trust health services, they are more likely to promote the mobilization of more resources for health through their mobilization of financial resources directly by using services or by paying premiums or contributing to of money in the public for states in general, but eventually also mobilizing political support to health programs, services, and pushing using various channels, political channels, for more allocation of resources for health. So this is in the way in discussion with Burkina Faso, and what will be very also a strong and motivating way for them to work for strategic purchasing in Burkina Faso.
Thanks so much. And to Gilda, during the panel, expert panel's tenure in Kenya, the issue of whether money was properly used and for which reason, you know, there was a lot of skepticism about generating more money became very topical. And therefore, you know, generating additional revenues was intrinsically linked to how well the existing funds are utilized. You heard this quite a lot. How were you able to present the arguments to the powers that be to support, you know, the matching by employers?
Thanks. As you remember, it was a hot potato because I think we're all alive to the fact of what had been happening before, and the skepticism by employers, whether they're ready to put in more money if more stringent structures and better structures have not been put in place, so that all funds coming in for a health scheme are fully and well utilized, and that even the providers, the service providers, which are the hospitals and all, and the systems are in place so that any payments made and any claims made are properly managed and monitored. And so there was a lot of, Julie, to answer you, there were different ideas. There were groups that said, I've said, no, sorry, they wanted to receive all the funds and manage it. And then there were others who said, this should all go straight to Kenya Revenue Authority, and they should be able to set up that, and KRA should manage all these funds and disburse to NHIF. And then there were other suggestions. There should be another different body, a fund different from the health scheme itself, receiving these funds for the health scheme. And that is still something that I because there was no amendment on that on the bill, it is still something that is very sensitive and has to still be monitored. And those are some of the gaps that I believe SPARC will need to continue monitoring and mentoring and seeing, working with the various parties to see what is best for the country, for the health system, without everybody, and nobody wants to give up money, as you know. But I think the way it would be presented and the way in the end, where it would go eventually is what would give people the confidence. So, right. So yeah, thanks, Matt.
So what I hear Gilda saying very clearly is that the health financing functions are intrinsically linked. You can't separate purchasing from pooling and from raising resources. And so to be able to raise resources, you actually must demonstrate that you are pooling effectively and also purchasing effectively. And that came up very strongly in Kenya. Elizabeth, there was a question about why is the concentration on strategic purchasing discussions mostly in the public sector and not the private sector? How would you relate, SPARC's efforts and strategic purchasing generally to the private sector? I don't know if Elizabeth heard me, but in the meantime, I'm sure Jean-Paul, you heard me also. You might just, okay, go ahead, please.
Yes, you went off towards the tail end, but I think you were talking about the role of the private sector.
Exactly.
So again, I'll start from saying, yes, a lot of concentration has been on the public sector, because of the advantages that the public sector brings in terms of pooling resources and providing services to a wider section of the population. But one of the things we learned through the framework was the fact that the different sectors have a role to play. So in each of our countries, we found that we needed to look at the different purchasing arrangements that we have. And we noted that fragmentation was a huge problem and we needed to deal with it. But we also noted that it's not going to be easy to deal with fragmentation. And so in the short run, the solution includes looking at what each sector has to provide. There are things the public sector can provide, could improve and provide, but there are also things that the private sector is better positioned to provide at the moment. Speaking for Uganda, for example, there are certain services that are in our benefit package, but then the public sector is not able to provide it. There are certain services that are required and the equipment, the specialists are lacking. And these are services that the private sector can provide. So identifying where the private sector has a competitive advantage is important, and having dialogue and negotiation with the private sector to see how they could be supported to do that. We've also noted that government could actually be able to subsidize some of the costs, or government could just have an arrangement with the private sector that could help them make that service more available. So we have realized that we need to bring in the private sector more and see where it has a role and how it can play that role more effectively by putting in the different instruments that are necessary to facilitate private sector involvement.
Thanks so much, Elizabeth. So I think we are going to draw close to ending this session, but there's a comment from Paul Pili, and is to the extent that we should explore, strategic purchasing from looking at things in a global way. That's just a comment. There was a question about why are we concentrating on policymakers and not also on consumers? What role can consumers play? Can you, in 30 seconds, tell me from your experience, Jean-Paul, what role can the consumer play?
The triangle: policymakers, providers, and consumers and population, I will say, is a real one. And one has to think about strategic purchasing in this triangle. So consumers play a very important role, like a third pillar of the house. The strategic purchasing structure sits on these three pillars, and we have to see them as all having a very strong strength.
All right, so the consumer is extremely important, the private sector is important. We heard about the risk of fragmentation as well, which we should guard against. On that note, I thank you all very much for your questions, and I thank Jean-Paul, again, Gilda, and Elizabeth for responding to your answers. At this point, I hand over back to Uju and the team.
Thank you so much, Nat, for that really amazing session. And thank you as well to our amazing panelists, Jean-Paul, Elizabeth, and Gilda. It was really insightful hearing from all of you. And it was a pleasure, really. Thank you so much for making the time. So for our final session for the day, I'm going to be handing over to Dr. George Kimathi. George is the director for the Institute of Capacity Development and AMREF, which is the department which houses SPARC directly under AMREF. And as the perfect way to end the session, he will be wrapping up by giving us an overview of some of the key lessons and achievements in phase 1, and also talk to us about our vision for SPARC for phase 2. Hello, George. Happy to have you here.
Uju, thank you. Thank you so much. And it's so inspiring to listening to our panelists plus Nate, Gilda, Elizabeth, Jean-Paul, really inspiring to listen to you and the experiences that we've gone through in phase 1, but also giving us your thoughts on what you believe that we should focus on in phase 2. And I will cover some bit of that in a while. But I think the key thing that I picked from all of you was we need to listen more, listen. We need to learn more, but also synthesize that learning and plow it back to support our countries to go through the reforms that they are struggling with. So that was really, really good. But again, I think when I was listening to our artists as we were starting this session, I think something that I picked that stuck in my mind was a line that they said, so far so good. And I think that's exactly what our panelists have been taking us through. But also, so far to go, there is so much to be done across the African continent. So at SPARC, we are extremely excited about what we've jointly achieved, and more importantly, what we've actually learned in phase 1 as we listen to our various speakers. But it's even more exciting because we have another 3.5 years that we have to do more, to learn more, but also support countries to spend better for better health outcomes in the continent. So our vision for phase 2, as Uju has said, together with our co-partners, technical partners, Resource for Development, whom we are very proud to partner with, is actually to see more countries deploying limited resources to promote equitable access to primary healthcare services through strategic purchasing. So we'll stay on course on that. So from today's conversation, listening to the panelists, looking at the comments that were coming from the floor, and also the questions, it is very, very clear that SPARC approach is making a huge difference in changing the conversation about strategic purchasing on the continent. And so we cannot pause, we can only do more. As the artists were saying, we can only fan the frame more and more and more. And therefore, in phase 2, what are we looking at? We really look forward to working with all of you to do 3 things. We have 3 pillars that we want to focus on. 1 is on institutionalization of SPARC. 2 is going to scale, as I mentioned, and also 3, sustainability. Just to get you into some bit of detail of what we mean by that. Institutionalization as I guess Nate and also Dr. Githinji alluded as we were starting, we are aiming to increase the technical expertise of health financing within SPARC, in particular, SPARC itself, grow the technical expertise, but also within AMREF itself in general, as the home of SPARC, linking that to AMREF's broader health financing agenda, which is our third pillar, as Githinji mentioned earlier. And therefore, we want to leverage as much as possible on AMREF footprint across the continent, the connections that AMREF has, and many other resources that we see within the host, including, of course, sharing the learning in AMREF's health financing community of practice. And talking of community of practice, SPARC is a key player. It's a very crucial player in the community of practice, which is looking at health financing within AMREF. So this is really core. So institutionalization, ensure that SPARC has a stable home and is supported to deliver on its mandate. And then two, is actually going to scale. So as we've listened to Jinpo sharing with us what is happening in Burkina Faso and the experiences that we've gone through during phase 1 in Luanda, and the good work that Nate and Gilda and the team at NHIF did in Kenya, and a lot of engagement, of course, going on in those 3 countries. This has been excellent, but we think in addition to that, we aim to position ourselves to respond to more demands that, of course, are coming from across a number of African countries, be able to increase that, but also too, that will only be achieved, we are able to increase the number of leading coaches and mentors like Jinpo and Nate to be able to respond to these demands, work with their coaches and technical partners across the continent, the 11 technical partners, perhaps more, so that we have a critical mass of coaches and mentors who can support us to reach as many countries as possible. And therefore, we also want to create a pathway, a growth pathway for these upcoming coaches through learning by doing. And I think I had that either from Jill for one of the panelists. Doing by doing, not fearing to fall and stand, not fearing to try, not fearing to innovate and find a path together with our colleagues from the ministries and the purchasers, but also mentors, supporting all these coaches and our colleagues within the countries and senior mentors again, so that we can bring up coaches and mentors from across the continent. We think that's going to be a key pillar for us. And that is sustainability. Currently, SPARC, as you know, is supported by BMGF, and we feel that there is a lot we can do in the next 3.5 years. So we'll deepen our scope of technical partners, generating evidence. I think I heard about evidence a lot in our conversation, documenting that evidence and increasing the local expertise across the countries. Of course, in direct connection with the ongoing reforms, learning from the reforms that we'll be supporting and applying that to whatever we are learning into those reforms, but also sharing that across the countries. That will be a key thing that we'll do. For instance, we have operated a two-year MOU with the University of Rwanda, which we are very proud of, and also the Ministry of Health in Rwanda, which has helped us to build local capacity for strategic purchasing and documenting evidence. And we think that to keep this alive, we are in discussions with the University of Rwanda and MOH in Rwanda and other partners and other players in Rwanda to renew this MOU, working with our technical partner, of course, the School of Public Health, the University of Rwanda, to support capacity building and evidence generation initiative that will sustain strategic purchasing reforms in the country, which is going on quite well. So these are the 3 pillars that we are looking at as we move to phase 2. And then finally, which is also really important, is that besides all that, we want to further aim to strengthen our technical and financial partnerships. So a lot of work around the business development, resource mobilization, so that we can sustain SPARC's approach. So beyond the resources that we are getting directly from the primary partner, primary donor, we want to see whether we can get more resources on board so that we can scale this approach, build the funded initiatives, but also broker further support for countries. So colleagues, this is extremely exciting for SPARC. Very, very exciting listening to the discussions for the past 1 hour or so. And we really look forward to partnering with all of you. And I want to repeat, all of you. It's been an exciting phase 1, and we look forward to a great phase 2. So we want to build on the solid foundation that has been laid in phase 1, and we want to translate the vision of phase 2 into reality. And this is our commitment, and we really look forward to continued engagement with all of you. And thank you so much. Merci beaucoup, our colleagues from the Western Francophone Africa. Very happy to see all of you. And back to you, Uju.
Thank you so much, George. And thank you once again to all our panelists, Gilda, Jean-Paul, Nat, Elizabeth, and Dr. Githinji. Just to add the final 3 punchlines to what the panelists shared. Our punchlines for phase 2, institutionalization, scale, and sustainability. And on that note, I will say thank you for joining us for this webinar. It has been a pleasure having you. Thank you for all your questions and all your engagement. And so on that note, I will say goodbye. Have a great day, everyone, and have a fantastic rest of your week. Bye, everyone.